I'm here today on Zoom with Professor Matt McQueen from our Department of Integrative Physiology at CU Boulder. I've asked Matt to give us an update on the coronavirus. Thanks for joining us, Matt.
Great to be here. Thanks.
So, Matt, what's the current status of the pandemic around the world?
Well, we in the Northern Hemisphere have reached a point where we're kind of taking stock of what just happened. This really hit the world, took the world by storm, as we know. And we are now at a moment where we are finally seeing sort of this aggressive exponential growth start to subside a bit. And with that, we're taking a breath as scientists and looking back at a lot of the data and information that has come out of this initial wave. And a lot of what we've learned by flattening the curve, obviously, that helped us avoid overwhelming our hospitals and medical system, but it also has given us a chance to conduct studies, both descriptive, but also a lot of clinical trials have been conducted in New York and around the world for us to better understand how to care for patients who are infected, understand the dynamics of the spread and the disease, and really who's most vulnerable. And so where we are now is both in a way looking back, but also looking forward. We want to understand, based upon what we've learned, how to best be prepared for what may be coming in the near future. As I say that's a very kind of Northern Hemisphere centric view. What we're seeing in the Southern Hemisphere, for example, in South America, is that they are dealing with their own exponential rise in cases. And the hope is that what we've learned in the Northern Hemisphere coming out of our spring, heading into our summer, they will be able to learn and apply those lessons to the epidemic and outbreaks that they're experiencing in those parts of the world.
Well, for us in the United States, what should we be aware of that's going to be happening in the next, let's say, 3 months, in the next 90 days?
As we head into the summer in the Northern Hemisphere, we need to be aware, right? There's a new reality, a new normal. We've again come from that really aggressive social distancing lockdown mode where we just had to do that because we didn't understand or know everything that we need to know about this thing early on. And so as we look forward from what we've learned, we know that there are certain issues that we need to avoid. We obviously understand now that really crowded, tightly packed places, particularly loud places because people are raising their voices, are areas that we need to really kind of keep under wraps for the next few months, but at the same time be very sensitive and cognizant of the economic impacts that this has all had. We certainly can't hide away for the next 18 months or 2 years to see where this goes. We need to move forward, but it doesn't mean that the normal that we had maybe in December or January is the normal that we're going to have moving forward. As a global community, we're watching what happens in the Southern Hemisphere very closely to see if they experience the same outbreaks. It looks like it's going to look the same trajectory there as it did here. And then just be very careful about expanding our social circles and networks. And if people are particularly vulnerable, for them to be careful as well. But we're really watching, we're sort of cautiously watching moving through the next 3 months. The hope that there is some seasonality to this, that we may, as people get outdoors, the spread will naturally be slower. We're watching that very closely as well. So I would say we're moving into kind of a cautious new normal as we slowly reopen.
That's great. Matt, we've been hearing a lot about vaccines and vaccine trials. What's the status of vaccines and getting a vaccine that's going to work?
Yeah, this is one of these, I think, remarkable efforts that have been to watch and witness across the world. Really a global collaboration of, identification of the sequence of this virus, which is an RNA virus, rapid identification of that sequence, to sharing that sequence, and then moving all the way towards, development of phase 1 trials. And so, as we've heard in the media over the last few weeks, there's been a handful of successful phase 1 trials. These are typically a smaller number of subjects. The one example is 8 subjects were part of this, and really the phase 1 is just to understand whether or not the vaccine itself is inducing the immune system to react to the challenge of the vaccine. Phase 2 is now underway, which is very exciting. Phase 2 will tell us then, additional properties about the immune response, but also additional safety profile, ensuring that, trying to get the dosage correct. What's the amount of, vaccine that will induce enough antibody response that it may confer immunity. And then all of that sets the stage for phase 3, which is what we're all really waiting for, which would be a very large scale kind of clinical trial on the effectiveness of the vaccine, which, there's a real mad dash, a race to get this developed before the fall, in anticipation of being able to test this out during the fall. And then again, if all goes well and this continues to move along in a very healthy and promising trajectory, the results of those phase 3 trials and these sort of later stage trials would be available later in the fall, early winter. And then on the backdrop of that, again, if we sort of hit it out of the park at each of those steps, vaccine may be available as early as, early 2021.
That's terrific. Thank you for sharing those various stages. I think that will be very helpful to our listeners. As the country begins to open up, what are the most important things that people should do to satisfy the way that they can navigate through the next phase of the pandemic?
The main feature to remember is that this is on the backdrop of a new normal. The risk is probably not going to ever be zero for you individually. And it's a difficult discussion to think about. We're doing things for two different reasons. One, for the kind of the public's health and keeping our medical infrastructure healthy and robust and able to handle an influx of cases, but also we're obviously balancing our own individual and family risk. So on the individual side of things, again, there's a gradient, and we now know from what we've learned over the past few months of the early phases of this pandemic that we want to avoid really crowded places. Poorly ventilated spaces seem to be particularly problematic. We're learning, for example, that if we think about this as sort of secondary infections, about 80% of these secondary infections likely arise from only 10% of primary cases. And what that's telling us is there's likely these sort of super spreading events that are occurring that really give this, kind of a leg up in terms of its trajectory of infection. And so to the degree possible, avoiding some of those trigger events and super spreading events will really keep the lid on this over the summer at least, and allow us to further plan and prepare society for further steps to reopen safely. So again, staying at home with your family as you've been doing, that's obviously the safest you can do. Venturing outside with family members and, visiting grocery stores and so on, very low risk, but, it's different than staying at home. And then gathering with new friends that you haven't seen in a while, again, in outdoor spaces, again, not terribly risky. And then you get to the most extreme where, you may be, packed into an environment or a restaurant where there's poor ventilation and people are surrounded you that are, you don't know, and no one's wearing masks and all that kind of stuff. So it really is a gradient that we have to experience. There's not really a sort of, this is risky, that's not risky. There's going to be a degree of risk that we have to accept.
So Matt, what's the biggest mistake an individual can make during this time?
From what we've learned, I think in the general sense, I think the biggest mistake could be to essentially throw out and ignore everything that we've learned. We've gone through a really difficult time that has cost lives, it's cost economic hardship, and it would be a shame if we move forward without taking the lessons that we've learned and evidence that we've gained really remarkably in a short period of time, and apply them to how we open up and interact in the future. So that's just a general comment. More specifically, again, if you find yourself in a situation in a very crowded environment where you find yourself, speaking quite loudly because it's a very loud environment, or yelling and screaming around people that you don't know, and in a very stuffy, low ceiling kind of building, those are the situations that typically, if someone is infected in that environment, it could spread quite rapidly.
As you know, we recently announced a comprehensive plan to get the campus up and running in the fall. And what advice would you give not only us, but other universities about opening up in the fall?
There are a lot of factors there. There's really a lot of primary prevention that we think of in public health, these primary prevention strategies that are really quite effective. I mean, the most extreme of the primary prevention was the lockdown. We don't want to go back to that. But there's a lot of things we can do. We can minimize the risk of infection through distancing, again, within spaces. You can also effectively reduce transmission from person to person by mask wearing, inside buildings in particular. But then beyond that, within the unique setting of higher education, thinking about new ways of organizing the classroom. How is the ventilation in the building? Can you improve air quality and keep fresh air in the building? Is it possible to keep the faculty member or instructor of a classroom, fairly distanced, from where the seating begins in the classroom? Within seating, we've learned that, front to back facing, for example, is probably the least risky in terms of transmission as opposed to circling around and facing each other. So there's a lot of these little details that'll be, really important as we open up. I think it's also important that, scientists and institutions of higher education really adopt these, sort of evidence-based practices, and which in itself will be a lesson for future generations to understand that these challenges, right, if we're guided by the principles of evidence and so on, that we can ensure a relatively safe environment for returning to campus.
Thank you, Matt. And thank you all for watching.
My pleasure, Chancellor. Thanks for having me as well.
Be safe, be healthy, and go Buffs.